Hey everyone, so this week we're going to take a look at the hip hinge. We're going to improve your toe touch. And for many of us, it's not really a matter of hamstrings that are too tight, but rather it is this area right here. It's the lower back and even the pelvis, the relative motion on both sides of the pelvis, your ability to flex and extend the tailbone. If you get those things in place, most of you are going to have a toe touch pretty easily without trying to lengthen your hamstrings. So with that, let's go ahead and get into this. So I'll just get started here. What you want to do initially is go get your foam roll. So that foam roll, typically they're about 18 inches, and you can see I've got that pressed up against the wall, in this case the door, and right up against the inside of my left knee. So the setup here is that I want to make sure that this shin is vertical, that the back leg is kind of in a kickstand position. We're not really in a full-on split squat position, but we are on the toes and we are back there a little ways. You can see the toes of that back leg are about a foot length away from the heel. Now that you're in position, we want to go ahead and grab the weight. Now this weight could be anywhere from 10 to 25 pounds. It doesn't have to be heavy. The important thing here is that it gives you a little bit of feedback. It gives a little bit of feedback into the spine, gives a little bit of core stability feedback. You'll notice also that that weight is going to drag the right shoulder forward. So I've got most of my weight, probably 80% of my weight is on the left leg. That weight is dragging my right shoulder forward. So I'm in just a little bit of rotation through here. Rotation through the spine, through the thoracic spine, through the trunk. That rotation is also going to help me with internal rotation of the left hip. So as you watch this cycle here, I'm going to breathe in on the way up. I'm going to exhale on the way down, which is going to help me with that internal rotation of the left hip. That internal rotation of the left hip, coupled with reaching straight back with this left hip. You can see how the knee's not really moving, the hip is moving straight back. So those two things are going to promote flexion and extension at the tailbone and relative motion on both sides of the pelvis. So now if you're having a little bit of trouble with that exercise, if that quite isn't getting us exactly what we want, we're going to take a step back actually and go into this position here. So this position kind of locks you in place a little more securely. There's no place for that knee to go. It's locked into place, which means the only thing that can move as you bend forward, if we keep the lower back straight, the only thing that can move, then once again, is this left hip. We're going to send that left hip straight back and get better at that hip hinge using this exercise. So again, kickstand position, not in a huge split stance, a little more of a split squat stance with this exercise. And let's go ahead and cycle this through. So again, exhale on the way down, and your head's going to come really close to that wall, really close to that door in this case. Probably not going to hit it. If you thump your head, just pull up a little bit next time. But you can see shin is vertical. Again, most of the foot contact, inside edge of the foot, knuckle of the big toe, inside edge of the heel. That's where we want most of the pressure. That vertical shin, straight low back, and then as we cycle this through, that hip goes forward and backwards. That's where that hip hinge is going to be improved, and that's where we're going to begin using our breath. We're going to begin getting that relative motion on both sides of the hip, getting the tailbone to flex and extend. All right, well, I'd love to hear your thoughts about this. Please reach out. You can text me or email me at any time with your questions. Once again, go ahead and get started on this toe touch. If you're wondering if this exercise is right for you, maybe we haven't talked about the toe touch before, or relative motion of the hip, maybe you're having some low back pain, this may be a really good exercise to free up your low back, your lumbopelvic region, and get started recovering motion and ability in this area. Would love to talk to you about that. Reach out, and I will see you again next time.